My name is Payal Patel. I'm a generalist OBGYN. I work at the Harvard Vanguard Wellesley practice, and I joined in 2010. So I speak a few different languages. I speak Spanish, I speak Gujarati, which is a distinct Indian language from the state of Gujarat. So it's not the most popular Indian language, but that's one of the few languages that I speak. In terms of how I tend to run my practice, I think my job is to present all of the information and all of the up-to-date information to patients, and then we can kind of come up with decisions together. So that oftentimes involves a lot of not just visits, but a lot of emailing with questions and kind of flexibility to changing in plans, because as life circumstances change, I think your plan of care oftentimes has to change. I do like surgery, that's part of the reason why I went into this field, but I think that's generally a last resort option. I like to kind of do things in a stepwise fashion, so maybe more conservative first, and then surgery as a last resort. I'm also a doctor that I don't like to take medicines, so I try to stay away from medications, but at the same time, if you need it, I would encourage you to take it, but I tend to be I'd try to explore alternatives to medications first. So my philosophy in terms of how I approach the initial obstetric patient is, we're here to get to know each other, and my job is to really support you and kind of lay the groundwork for what ultimately is going to be one of the most important experiences, if not the most important experience of your life. So it's really getting to know each other and kind of laying a groundwork for the next 10 months. No question is a dumb question. Every question is completely reasonable and should be asked, because I encourage patients to take advantage of the fact that they're going to see a provider 13 times in 10 months. And it's a very unique time in your life in that sense. So I encourage patients to call us all the time, email me anytime, because no question is unimportant.